Corps. Today we are going to be kind of reviewing all things performance measures. So prior to that, we'll have Jan and Daisy coming on to offer some information on timekeeping. Jana Daisy is a program officer with Volunteer Iowa, and she kind of supports us with all things grant compliance. So she's an expert when it comes to the ins and outs of AmeriCorps grants, and specifically she's going to present on timekeeping. So kind of you as supervisors, you're all responsible for reviewing timesheets, approving them. I know it is really easy to just kind of give it a glance over and maybe hit approve, but we want to take some time to go over like kind of the things that you should be looking out for, maybe what we would consider timekeeping red flags, so that you can be a bit more intentional when you're reviewing those timesheets. Go over some other timekeeping do's and don'ts. And then after Jan is done with her presentation, she'll hop off and then we'll cover performance measures. So what you and your member should be tracking throughout their service so that when time comes to complete the AmeriCorps progress reports, you feel confident in what you're reporting and it is a super smooth process. So for that will be divided into two halves. So from 2 to 2:30, we'll cover the national performance measures. So those are performance measures that all of our members across the board will have to report. And then after that, for the last half hour, we will review the Youth Mental Health Core performance measures. So 70% of our members need to serve in a youth mental health core capacity. So quite a few of you will probably stay on for that last session of the training. And for those who do not have youth mental health core members or don't plan to have youth mental health core members, you get an extra half hour back to your day. So congratulations. All right, so we will go ahead and get started. Jana, do you want to take over?
Yes, thank you. All right, I am hopefully sharing my PowerPoint. Can everyone see the slides? Perfect, yeah. Thank you. So yes, as Erin said, my name is Jana Daisy and I'm with Volunteer Iowa. And today specifically, we'll be talking about member timekeeping. For those of you who are not new to being a host site supervisor, some of this will probably just be review. But for those of you who are newer, this might be some new information. And feel free to interrupt, raise your hand, ask questions, put something in the chat, whatever, whatever is easiest for you. And I will apologize in advance that this is a very text-heavy slide deck, which I don't love doing. But I also wanted to hopefully be able to share this with Erin after. And so that way you have, excuse me, all the information easily available. So with that, we will start with just kind of the basics. You know, it's really important that timekeeping is accurate and is recorded properly. That is, it's how member attendance is kept. It's how members remain eligible for their living allowance and their benefits during service, as well as their post-service benefits, their education award that they receive afterwards. If anyone just really loves reading through policy, there are a couple of, excuse me, sections of the Code of Federal Records that specifically outline timekeeping related information. So the first one listed relates to limitations on training and fundraising hours. Then we have prohibited activities. And lastly, duplication and displacement of employees and the restrictions around those. So you have those available to you if you want to do a little light reading at a later time. So timekeeping requirements. There are a lot of things to keep in mind. The first three kind of all go together on here. So the first, they're kind of all around making sure that members are not serving excessive amounts of time, that they're not being burnt out, that they're not being asked to do too much. And so that's kind of what these first three really cover. Limit of 12 hours a day, or looking at a 2-week pay period, no more than 100 hours or 200 hours in a month. That's kind of the max that a member would be allowed to serve in any of those like increments of time. And then along with that, members who serve more than 5 hours, they are required to take a 30-minute break, like a meal break or whatever kind of break. And those 30 minutes are not counted as part of their service hours. So really 5.5 hours. And then anyone serving over 11 hours would be required two unpaid meal breaks. So it's 5 hours of service, but maybe 5.5 hours, 11 hours of service, but really 12. So when you look at that 12-hour limit, it could really be a 13-hour day for a person once you add in those two meal breaks. And that's a really long day for someone. So we want to just kind of make sure that we're keeping an eye on that and limiting the amount of times that members are asked to do that. And then the third one is not serving more than 6 consecutive days. So again, kind of that same thing. We understand that there might be some exceptions, members who are helping in times of disaster, members who are maybe helping with like a special one-time weekend camp or event that's being held that's not like the normal part of their service. Some of those sometimes our conservation related programs will have weather constraints. And so sometimes they might have some longer weeks because they have to get the work in when the weather is cooperating. But for the most part, 6 days is the max they should be serving consecutively, so that they get at least that one day off. And then there are 6 holidays, federal holidays that, excuse me, that members are required to have off. Those are New Year's Day, Memorial Day, 4th of July, Labor Day, Thanksgiving, and Christmas Day. If one of those days or if all of those days happen to be days that your host site is operating and open, and there's some reason that you would need your member to serve on one of those days, then we'd want to know that in advance and what the reason is, what they'd be doing on that day, and would need to give, excuse me, prior approval. And I see the question that came up in the chat, Erin. Thank you for asking that or answering that question. Okay. And then the small amounts of time, I know that Erin has heard this. I don't know if the rest of you have heard this, but small amounts of time specifically on weekends. And what we're trying to avoid is, certainly if it's part of a member service schedule that they serve on weekends, then serving on weekends is fine. What it's really trying to avoid is a member logs in for 15 minutes to check their calendar for the week and submit their timesheet, and they're logging that as service hours. If someone were to audit timesheets and look at that, they're going to say, what meaningful service were they doing for 15 minutes on a Sunday afternoon or a Saturday afternoon? So it's trying to avoid those short increments where they're not really doing meaningful service. It's not something on their, I'm guessing most member position descriptions don't say member will be required to check email on weekends or things like that. So it's making sure that they're doing activities that are on their position description and that it's that meaningful service, not just responding to an email or something like that. And then the last one is related to 0-hour timesheets. And so that's a situation where a member, maybe they're sick or they're on vacation or it's holiday break from school or things like that, where they might miss an entire pay period and have to submit a 0-hour timesheet. Those circumstances should be rare, and they should be those kind of one-off things like a vacation or something like that. Ideally, we would want them to let you know as soon as possible that they have something like that planned and coming up, so that you can prepare also to make sure that they're getting their hours in if one of those comes up. If you have members who have multiple 0-hour timesheets, then probably a bigger conversation needs to be had about their service schedule and their ability to serve. And members wouldn't be suspended for like a 2 week vacation or something like that. So it really would just be kind of that 0 hour timesheet. Any questions? More questions before we move on? All right.
Is there an
Yeah.
approval process on your guys' side with holiday vacations? I know like our member is going to be taking some time off for the holidays soon, and like I approve that because a lot of our other staff are gone, and there's
Mhm.
there's not really a whole lot to do around the office. So is there some other thing? Because yeah.
Yeah. Thank you for asking. We wouldn't need to like approve that. It is kind of nice to have that heads up so that as we're going through timesheets, we're not like questioning it or wondering what's going on. If we know in advance, that can be helpful, but we don't need to like approve that or anything.
Yeah, and I would say just make sure that you have a plan in place with a member to make those hours up either prior to them leaving or when they get back.
Was this enough heads up to tell you now, or should I email
Yeah,
too?
you're all good. Thanks, Zach.
Great, thank you, appreciate it.
Awesome. Okay. Um, oops.
Hi, Grace had the question, what is the best way to handle a student's changing schedule from fall to spring semester, such as a reduction in hours based on classes? That's a great question, Grace. We have a lot of members who are students and have changing schedules. That I would say, let's just have a meeting, Grace, and we can talk through maybe revising Mary's anticipated service schedule to be able to ensure that she is still on track. So something we would plan together on a case-by-case basis. Yeah.
Thanks, Erin. Okay, so anticipated service schedule, that segues nicely to talking about that. This is something that you would have already been planning with Erin that you put together before your member begins service, or if you have other positions that you're filling later on in the year that you're, keeping in mind their anticipated service schedule should be included in their position description, and certainly want to make sure that it aligns with what your need is in your organization, your community. If you really need people from 4 to 7 p.m., it doesn't make sense for the member to be serving in the mornings. So obviously want to make sure that it aligns with what your needs are. And then including, excuse me, the minimum number of hours per week that a member should be completing. We also always require at least a 10% buffer in a member's term of service. So if they're serving a 300-hour term of service, we would recommend that you take 330 hours and divide that over the number of weeks that they're serving. And that's kind of their anticipated service schedule. It just builds in that little bit of cushion for those situations that come up where they need a day off or they're sick, or those types of things to help keep them on track. One other thing that we've seen sometimes is that there are members who are very close on their hours. Maybe their 300-hour term, they serve 302 hours, and they find there was some sort of training that they counted as training hours that maybe they shouldn't have been able to count as training hours, or something that becomes disallowed on their timesheet, and they have to remove those hours. When they're really close to their required number, it doesn't really leave a lot of wiggle room if something ends up being disallowed, and then that could put them at risk for losing their education award. So we just want to make sure that there's plenty of that cushion there just in case. And it does say on here, members do not get sick leave or vacation. And what that means is just like paid or allocated time. So they can be sick. They don't have to come in if they're sick, but they just can't count those hours towards their total. And then not serving at days and times that are not included in their anticipated service schedule. And if you find that a need arises where they need to come on a day, or they're it would be helpful if you had them there on a day that's not part of their service schedule. Just reach out to Erin and you can try to revise that as needed. Any other questions here? Okay. Kind of piggybacking off of that, one of the things that that we like to help people keep in mind as you're planning those anticipated service schedules is this idea of occasional and what that really means when you're talking about occasional evenings or occasional weekends. Going off of the definition from the U.S. Bureau of Labor and Statistics, it really means 2 to 30% of the time. And so if you look at, for example, a 10-week term of service, that would be 3 occasions. So if more than 3 times in that 10 weeks of service, they would need to be there in an evening or on a weekend, then probably the anticipated service schedule shouldn't say occasional. It should just say evenings are required or whatever the time is, just to make sure that it's a reasonable expectation. Saying occasional weekends and then every other weekend they're serving, that's more than occasional. Teleservice is another question that we get asked, thing that we get asked a lot of questions about. And so just wanted to talk a little bit about teleservice. All of your programs, or I think Erin's program in general, should have a teleservice policy. And that'll vary program to program. But teleservice, the way AmeriCorps defines it, is service outside of your program site. What that means though is like serving at home or a coffee shop or something like that. If you have multiple locations or a member is presenting at a school, that's not really teleservice. That's just part of their regular service. It's more of that like doing work at home or from a coffee shop or a library or something like that. Teleservice should be limited, and the member and site supervisor need to agree in advance exactly what that's going to look like, how long it will take the member to complete that service, how they will be in contact. The member needs to be accessible by the supervisor. The supervisor needs to be accessible to the member during that time, so that if they have questions or need things, that they're able to get what they need to be able to successfully complete that service. This can be a great option during inclement weather. So if the member has a computer or access to work that they can do without having to like drive to the site, then that can be a good option in those circumstances as well. And this last one, and that's kind of the big kicker, I think, for a lot of things, is making sure that the teleservice can be meaningfully supervised and that the hours can be independently verified. And so there can be a number of ways that you can do that. Some programs, for example, have an online training that they require members to complete, and they allow them to complete that on their own time. But that online training system provides a log at the end of when they complete it. It's a completion certificate so that you can see they clearly completed it. A lot of times it'll say like how long it took them to complete it or some of that basic information. So that's a good example of how you could independently verify that information that the member did it on their own. So any teleservice just needs to be pretty well defined before it happens of how you'll be able to supervise and independently verify those hours. Yes. Projects with clear deliverables. It's a great example. Any questions about teleservice?
Go ahead, Abdullahi.
I was going to ask, are we able to see that log that you mentioned on one of the links that you have shared with us, or how would we be able to track that?
The teleservice.
Yes.
So that
like-
should be a shared spreadsheet that you have with you and your member.
Okay. Okay. Sounds good.
All right. So just a couple of red flags, things to be aware of. The Office of inspector general is who would be like auditing or reviewing timekeeping records, any of our information. I want to pause really quick. Grace,
Yeah.
did you have a question?
Oh, yes, thank you. So one of the activities that I've had, I actually have a couple different students working on this because it ends up working out kind of well for both of their kind of educational backgrounds. Is I have them like work on like a public health certificate, like while it's just like an online training kind of while they're not here in the office. And then we come back, we talk about what they learned, apply it to like our daily work in local public health. For those programs, they have set number of like CEUs or contact hours. So maybe it's like a 3-hour learning. At that, because they're completing it remotely, I mean, that's the time that has been assigned to it. I mean, is there anything additional that I need to be doing for that? As far as I understand, it's taking them that amount of time to complete it. Is there anything additional I need to be doing for that?
Does it give them some sort of like completion certificate or
Yeah,
verification?
yeah. When they're done, it just says, so and so completed this on XYZ day for, 3 CEUs, even though that's not how we've been doing things.
Yeah, I think documenting that, and if they are able to tell you in advance when they're planning to do it, like I'm going to work on this tonight or this weekend or whatever, I think that can be helpful too. It's just additional documentation that's kind of what they planned.
Sure, that sounds good. Thank you.
Erin, anything you'd add?
I would consider that to be sufficient. It's a clear record. Their time.
Thank you. So just a couple of other things to keep in mind as you're reviewing timesheets. If all of the timesheets that a member is submitting look exactly the same, they're always doing 1 hour of training on Monday and then 6 hours of service or whatever. There's never any variation. That can sometimes be a red flag. Certainly, I suppose that could happen, but it's pretty uncommon. Preloading hours in the timesheet, so submitting in advance of when they actually serve. Excessive or unusual corrections. So if they're constantly like asking for it to be unlocked or needing to make changes, that can be a red flag. Unusual or excessive hours. So if they normally serve 5 hours a day, and like 15 hours a week, and then all of a sudden they're serving 45 hours a week and you didn't have an event or some logical explanation for that, that's a big red flag. Some of those kinds of things. Late timesheets, if they're constantly submitted late, 2 or more in a row that haven't been submitted or approved, and then increased hours served at the end of the term. So again, if they're kind of consistently serving 20 hours a pay period, and then all of a sudden their last 2 pay periods, they're serving 80 hours, that's a pretty big red flag too. Timesheet certifications. So you've probably seen in Encore, there are some certifications that both the member has to agree to or approve when they're submitting their time, as well as one that the supervisor has to check that they are certifying that everything is correct to the best of your knowledge. It's just if there are issues that can result in disallowed hours, and that could negatively impact the member down the road. So, just making sure that everything is accurate in advance is what we want. A few do's to keep in mind: encourage members to add time to their timesheets at the end of the day, every day or every couple days at most. I know even if I waited until the end of the pay period, I couldn't tell you what I was doing 2 weeks ago. So, staying on top of submitting that within a day or two, entering time in quarter-hour increments. So the system, I don't think will allow anything outside of like a every 15 minutes. So they can't enter like a 10-minute increment or something like that. Making sure that members are entering their training hours, that they're keeping track of their training and that they're submitting that. There are some times where a member will be 2 months in and it will appear that they've had no training, and that can be questionable too, because they've certainly at least had, hopefully, had some training to kind of start their service. Ensuring that meal breaks are being removed from their total hours, reminding members to submit them as required, using tools and resources provided to help the members stay on track. So certainly your anticipated service schedule. Also, Encore has a benchmark planner. It's like a little planning tool within Encore, or they could use a spreadsheet or something too if they'd rather, where they can kind of map out their hours over the course of their service. So if they know they're going to be on a break or vacation and they're going to miss certain days, they can kind of play around with numbers like, okay, well, if I serve 2 extra hours on this day and 2 extra hours on this day, and kind of see where that total falls at the end of their service. And that can be really helpful to plan, especially around some of those anticipated days where they won't be able to serve. Reminding members to communicate with you about any planned absences that they may have, and then double checking to make sure that they're entering all of their allowable hours. That can help prevent needing to unlock timesheets later. And then we have the do's. We also have the don'ts. No preloading hours. That includes even at the beginning of their day. So they come in at 8 a.m. and try to just log their hours for the whole day. That I understand, and they don't have to remember it later, but they don't know for sure. Something's going to come up and that might change. So that's not allowed. Reminding them not to serve those small amounts of time on days that they're not scheduled. Not adding hours for a weekend if they serve, or if they're counting half an hour on a Saturday and they just want to tack it on to their hours on Monday, that's not allowed. They can't submit hours for a day that they didn't from a different day onto another service day, if that makes sense. Communicating if they have questions, if you have questions, please do not put those comments in Encore. Anything that's documented in Encore is documented in Encore forever, and is open to then any like questions, scrutiny, you name it. Just if you have a question, email them, text them, call them, ask them somewhere else outside of Encore, and make sure that that's communicated to the member as well if they have questions or want to explain something, that they're documenting that outside of the Encore system. And then obviously making sure that their hours line up with their term of service, that they aren't including hours before their start date or trying to submit hours after their end date. And that they're only including time for activities included in their position description. So sometimes there might be situations where you have an event that you're doing and the member wants to come and help and participate. If that's not part of their position description, if it's not part of their like regular service activities, they are welcome to come and help you as a volunteer, but those hours would not be allowable for their service. And I'm sorry, I know we're at time, so I'm going to try to speed up a bit.
That's okay.
Okay. If there are errors and issues, this kind of applies to Erin, but you could send Erin exactly the information that she needs to send to us. So the member's name, the period of time, which timesheet that we need to open up, which program year, especially if it's in the fall when we might have 2 program years going at the same time, and the reason that the timesheet needs to be corrected. So if you send that to Erin, then she can forward that on to me to make sure that we can unlock a timesheet for a member that needs correction. If a timesheet has been submitted by a member, but you as a supervisor have not yet approved it, then you can reject it and send it back to the member and they can make their corrections without us having to unlock that. And you all or Erin shouldn't open or make changes to the member's timesheet or submit anything on their behalf. That needs to go through Volunteer Iowa. So please don't ask Erin to do that. And then, again, please don't add comments to the timesheets. If you need to communicate about something, please do that outside of Encore. And so here's a couple of examples of comments that people have put on their timesheets that are very problematic. So, for example, I would question this comment. Were those activities that the coach came up with part of your position description? Were they meaningful service? These are things that are now just like permanently part of the record. So please don't do it. And so I'll just move ahead. A couple other quick things. Timesheets can only have changes made if it's within the last 90 days. If it's been longer than that, we can't make corrections or changes to the timesheets. Additionally, if it's the last 30 days of the member's term of service, we can't make any corrections for anything older than 20 days. Once a member has ended their term, corrections must be made within 10 days of their exit. So just kind of some things to keep in mind. As you're getting near their exit, the window of time to make those corrections does get much shorter. Okay, if a member has something, if, say, for example, they have not hit their number of hours and they realize that there was something, they attended training at Habitat for Humanity 2 months ago, and, well, not even 2 months ago, 2 weeks ago, we'll say. And they didn't document that because they didn't think that it would qualify as training hours. And they find out that actually those training hours could be counted towards their service because it was related. They would need documentation from Habitat for Humanity with their attendance, verifying that, yes, this is the date that it happened, this was how long it lasted, yes, this person was in attendance. They can't just provide a statement themselves. It needs to be something that was recorded by someone else and verified previously. They can't just write something up in that moment. Hopefully that makes sense. And then we would review that information and determine whether or not it could be approved. When a member is exiting, kind of at the end of their term, you want to make sure that there are the same number of timesheets as there are living allowance payments, making sure that, excuse me, all of their timesheets have been submitted, that they've been approved. If a member exit service without completing a timesheet, sometimes if they exit for cause, if they leave their service early for some reason, maybe their final timesheet was not submitted. In those circumstances, there need to be several attempts made to get a hold of that member to complete that timesheet, and document that you've tried to get a hold of them to complete that timesheet. If you've asked several times and they still have not completed it, then what you need to do is document the hours, what you can verify. These are the days that they served and the hours they served. And I can certify that as the supervisor, send that on to Erin, and then Erin will forward that to Volunteer Iowa, and then we can submit that timesheet on behalf of that member, as long as we have all of that documentation. I'm just going to kind of skip through some of this. Okay. Any questions about timekeeping, Encore, any of that stuff?
We got all our questions out throughout the presentation.
That's all right.
Good, which is great.
Yes. Right. Well, I will share this the slides with Erin. My contact information is on this slide, as well as Jane Mild, who's the other person in our office who helps with timekeeping and compliance. So feel free to reach out to either one of us if you have any questions. And thank you for giving me some of your time today. Appreciate it.
Thank you, Jana. Thanks so much for the thorough presentation. I think it's really helpful to understand like the importance of timekeeping from a compliance perspective. So thank you.
Thank you. I know it's not always the most fun, but all All right. Enjoy the rest of your afternoon. Thank you.
Thanks. Okay, I will just jump right into my slides now for performance measures. Did anyone have any questions prior to jumping into the next step okay. Now that the boss is gone. Just kidding. Okay. All right, everyone can see the slide. I can't see you guys now that I'm in presentation mode, so I can't monitor the chat. So if you do have a question, if you could just come off mute and ask away or wait till the end, it's up to you. I'm totally fine with being interrupted. So feel free to ask questions. Again, I want to make sure I get you guys out of here at 3 o'clock. So I'm just gonna jump on in. Okay, so we're going to talk about performance measures, which all of you have experience in managing grants and know how important performance measures are. They essentially, tell our story and demonstrate that we are being good stewards with our funds and we're doing the things that we said we were going to do in the grant in our original grant application. So I wanted to provide a very quick overview of how our program is funded, because obviously that informs our performance measures. So our grant is funded through a mix of public and private funds. So our public funds come from AmeriCorps, the federal agency. That's our AmeriCorps state and national grant, which is awarded through Volunteer Iowa. So the majority of our funding comes from those federal funds. And so, of course, as a federal grant, there are a lot of rules and regulations surrounding that, and very specific national performance measures that we have to meet. In addition to that, about 30% of our funding comes from our Youth Mental Health Corps grant. This is a private grant made available to us through the Schultz Foundation. This is a 2-year program, and essentially the Youth Mental Health Corps is kind of a cohort within our cohort. So not all of our members are serving in a Youth Mental Health Corps capacity, but a large number of them are. And so there are also some specific training and reporting requirements for those Youth Mental Health Corps members. So we're going to talk about both of those, and we'll start with our national performance measures. So I'm going to very quickly go over our program goals and objectives, because those outline kind of what our performance measures are and inform the data that we're going to collect. So our goals are that organizations in Iowa will have improved capacity to serve communities in the areas of food security, resource navigation, and youth mental health as a result of AmeriCorps service and member placement. Also, we have a goal that community members will be engaged to increase the overall impact of our member service projects, and we aim to strengthen and grow the community health workforce through intentional training and hands-on experience. So those are our program goals, and our objectives are the how. So how we plan to do it and how we're going to demonstrate that we've met those goals. So one is we want to place 36 members at a minimum of 20 host sites across the state in both urban and rural communities. Once our members are in service, they will support capacity building projects to expand, enhance, or improve the programs and services at their host sites. In terms of community engagement, our members will collectively manage, train, and recruit a minimum of 100 volunteers to increase the overall impact of their projects. And then each of our members will have their own professional development plan that includes career coaching, hands-on training, trainings with the cohort, as well as the online community health worker training and certificate. So as far as our performance measures, our national performance measure is capacity building. So we need to demonstrate that our AmeriCorps members are building capacity at their sites. So capacity building activities expand the scale, reach, efficiency, and effectiveness of programs, services, and organizations as a whole. So there are a lot of different ways that we can demonstrate capacity building, but in general, it's important that what your members are doing is not just kind of supporting the day-to-day operations of the organization. They really need to be contributing in, and completing activities in ways that are actually going to, enable you to serve more individuals, serve new populations, pilot new programs, create systems and resources that make your programs and services more effective or efficient. So that's what we mean when we refer to capacity building. So with our national performance measures, if any of you are familiar with the theory of change and logic models and all that fun stuff, we have outputs and we have outcomes. So our output is the amount of service that we will provide through our program. So our output is that 20 organizations will report receiving capacity building services. So we will place members at a minimum of 20 host site organizations with a unique position description that outlines their capacity building activities. That's how we will track our output. And then our outcome is the actual change that occurs. So the actual results of the intervention. So our output is that of those 20 organizations, at least 18, if not more, we hope all of our host sites will experience capacity building as a result of our member service. But at least 18 organizations will report that capacity was in fact expanded at their organization as a result of their core member service activities. And then our third performance measure is the volunteer engagement. So we want at least 100 volunteers to be recruited, trained, or managed by our AmeriCorps members. So a lot of our members engage with volunteers and have volunteer coordination and engagement activities in their position descriptions. Not all of them do. So again, the expectation is that collectively across the board, our members will engage 100 volunteers. In some instances that would not be appropriate, depending on your member's position description. So if your member does not have volunteer coordination or engagement written into their position description, then they do not need to track the number of volunteers. Okay, so going into how we measure capacity building. Capacity building is kind of this ambiguous thing. It's kind of subjective, right? Like there are a lot of different ways that we can build capacity at different organizations. And every site is unique. Every site has their own programs and services that they're providing, their own distinct populations that they're serving. And so capacity building at one site is not going to look the same as it is at another site. So when we're measuring capacity building, it is really a site-defined measure. So each site will identify which measures they will track throughout the member service to demonstrate their capacity building activities. So depending on the member's position description, that could be the number of resources that they create throughout their service. It could be the number of events that they coordinate, the number of partnerships that have been established, the number of individuals served, or the number of systems developed. It could be an additional measure. It could be a combination of these things. What's most important is that you've identified at least 2 metrics that you will track throughout their service. So definitely make sure you're looking at your members' position description and seeing what their clear goals and objectives are within their position description, and then identify which metrics you will be able to systematically track throughout their service. And the nice thing is their capacity building activities are already written into their position description. So you don't need to track every single activity that they complete. You really just need to pick at least 2 measures that you can systematically track. And I would choose something that you can easily track. throughout their service. So their capacity building activities are going to be reported twice throughout their service, at the midterm progress report and the final progress report. So I just added some screenshots of that report that you will complete via a Cognito link. So you may have this link already if you have a member enrolled, but the link to the report, I've just taken some screenshots directly from it. So we can kind of go through each section one by one. So that way there's no surprises when it comes time to report your members' activities. So first section is just kind of an introduction, some key definitions, what capacity building is. Again, it's a site-defined measure. So you will want to complete the form and provide up to 5 site-defined measures that highlight your members' capacity building activities for the reporting period. So next, you'll list the member's name, their title, your host site organization, the county where you're located, and make sure that you're selecting the correct reporting period. So either midterm, which will include the period from September 1st through March 31st. So essentially from the start of your member service through March 31st, and then end of term will be from the start of their service through the end of their service, or August 31st, whichever comes earlier. And then we'll want you to provide a short description of the goals of their position. So, you can find that if you just refer back to their position description. So quick outline of the need at your organization and how the member is filling that need. Next, you'll indicate which of our focus areas your member service activities fall under. So our focus areas are food security, resource navigation, community engagement, and youth mental health. You can select more than one, so check all that apply. And then you'll answer yes or no. Has your member provided capacity building services during the reporting period? That is the goal of our program. So my hope is that you will all answer yes to that question. And then you will indicate which of the following capacity building categories your member activities fall under. So for some members, they really might be focusing on, expanding scale or reach. So that could be, conducting outreach and education to reach more people, or piloting a new program, or targeting a new population so that you're reaching a new population. So that would be scale or reach. Effectiveness would be maybe developing resources or systems to improve the quality of programming at your site. And then efficiency, similar, so maybe systems development, resource development, that results in your organization being able to operate more efficiently. Or you can select none, the member did not provide capacity building services. So please select all that apply there. And then we're going to want you to provide some qualitative data. So provide a few sentences to really just outline, maybe your members' biggest accomplishments for that reporting period. Provide just some information on some of their capacity building activities, whether that's resource development, systems development, training, or volunteer management, or something else. We really just want to have some qualitative data to back up the quantitative data that you also report. So for the next section, this is where you'll be reporting the quantitative metrics that you've been tracking over time. So for this section, please identify up to 5 site-defined measures to provide quantitative data to support the qualitative data you have already provided. Some examples of site-defined measures can include the number of volunteers recruited or managed, the number of meals served, number of resources developed, number of training materials created. So again, it's going to be a site-defined measure. Do what makes the most sense for your organization. You'll list the amount of time or the time period associated with the member service term and then compare it to the time period for their previous year. So you're going to want to, if your member's serving a 9-month period, and you're reporting on that, then you'll want to compare the same metric to the same time period for their previous year, to demonstrate that, maybe you've been able to serve more people than you were the time period before as a result of the member service. Or if the member is, if they're piloting a new program, then your baseline would be 0. So whatever is kind of easiest for your organization to track, you can, if there's already data that you're collecting, that may be easy. Or if it's a brand new program or your member is like developing resources that were not available before, in that case, your baseline would be 0 as well. Okay, after you report that quantitative data, the last section will just be checking the box to state whether you agree or disagree that as a result of AmeriCorps member placement, the host site organization expanded capacity. So this will be on a Likert scale. And this is how this is like the performance measure that we will ultimately report. Like the number of organizations that report expanded capacity will be based on the level of agreement to these statements, and then the data that you provide will help to back this up. So we'll ask, as a result of AmeriCorps member placement, host site organization expanded capacity, whether you agree that the AmeriCorps member brings value to the host site organization, and whether the AmeriCorps program brings value to the host site organization. So that will be how you report the capacity building activities. And then the second will be volunteer tracking. So the capacity building activities are really the responsibility of the site supervisor to track, but you may need the support of your member to help you systematically track those metrics. So you may want to sit down with your member and have that conversation with them so that they know, this is what we're going to be tracking, and maybe you need their assistance with that. But ultimately, the responsibility of the reporting is on the supervisor. When it comes to volunteer tracking, that will be the responsibility of the member, because again, that's something they might be doing on a day-to-day basis. They're directly engaging with those individuals, so it makes sense for them to be the one tracking their engagement with each of these individuals, because it's not something you're probably going to be directly supervising on a day-to-day basis. So we do ask that the members keep track of their volunteer engagement in an Excel spreadsheet. And then when you submit the progress report, you will upload that file. So the members should be tracking volunteers when the time. Did someone have a question?
No, my headphones keep stopping and starting. I'm so sorry. I didn't mean to.
Oh, that's okay. No problem. So when it comes time to submit the progress report, make sure that you upload the volunteer tracking spreadsheet that your member has been completing throughout their service term, and make sure that if they have volunteer engagement activities listed in their position description, please make sure you're checking in occasionally and making sure that they are, in fact, filling out this spreadsheet throughout their service. So we'll go over the spreadsheet really quickly. So again, volunteer tracking is the responsibility of the member. They should start now if they have not already. We want to make sure that we're not duplicating volunteers. So they need to have a way to track those volunteers either by name or unique identifier. And the numbers that we're going to report on our end are the total number of volunteers and then the total number of hours that the member spends with those volunteers. So the member should only be counting volunteers that they're responsible for, whether they're recruiting them, managing them, training them, supervising, coordinating. It should only be the volunteers that the member's actively engaging with. So, if you do already track volunteers and you pull that data, like maybe you're already tracking the volunteer hours, that's going to be the volunteers' total number of hours that they volunteered at the organization, not necessarily the number of hours that they've spent with the member. So that's why we want the member to be tracking this separately. So first sheet on there, they'll complete this cover sheet. So instructions are listed here, and then they'll report, their name, their host site, and then after they do the math on the next spreadsheet, they'll report the total number of volunteers they recruited, trained, or managed during the reporting period, and then the total number of hours served by those volunteers. This is the sheet they will use to track the volunteers over time. I don't need to know the dates that they spent with each volunteer. I just need to know ultimately the total number of hours. So they'll list the volunteer's first name, last name, or unique identifier, and then the number of hours that individual volunteered with the member for each occurrence. So I've provided an example here. So they'll want to track over time. If the volunteer only volunteers with them one time, then they'll just list that under the first occurrence. But if they volunteer a second, third, and fourth time, we want them to track that so we can ultimately get the total number of hours that they've volunteered over the duration of the reporting period. I listed out 10 occurrences. And if the member has a volunteer that happens to, maybe they're a very regular recurring volunteer and they engage for more than 10 occurrences, that's fine. The member should just add additional columns for each occurrence. And then ultimately they should sum the values of each occurrence to get the total number of hours volunteered for that reporting period. So any questions about volunteer tracking or capacity building? Okay. Awesome. Next item that supervisors are responsible for is the member evaluation. So again, those performance measures will be reported on twice per service term for each member. And then the evaluation will also be completed twice per service term. So once at the middle of the member's term and then again at the end. This is kind of what the evaluation looks like. It's pretty straightforward. It should probably take you, maybe no more than an hour to complete, but we just want you to provide some input on how the member's doing, what their strengths are, what their weaknesses are, and really have an intentional conversation with them following up on the evaluation so that, they know what their strengths are, and then they know what maybe they need to work on moving forward. So those are the main responsibilities for site supervisors: timekeeping, reporting of performance measures, and the evaluations. So some important deadlines for that: April 15th is when the national performance measures are due for the start of service through March 31st of next year. And then September 15th is when the performance measures are due for the start of service through August 31st. If your member service term ends prior to that, then we'll have you submit the final performance measures within a week of your member's end date. And then these performance measures will include both capacity building and volunteer tracking. For evaluations, the evaluations are due at month 4 of the member service and month 8 of their service term. This is also when we send invoices out for the host site fee, so those will come to you at the same time. So any questions about that? Does it seem pretty straightforward? Does it feel feasible? I'm gonna take
And I just want to, I want
Yes.
to, I want to clarify, please. So the performance measures documents and the
Mhm.
evaluation do not coordinate time-wise. Is that
They
correct?
do not. Yes. So the
Okay.
progress report is all, yeah, because we have members who are starting at all different time periods. So members are kind of being enrolled on a rolling basis, so we can't align the progress reports with that. So it will just be halfway through the member service and then the end for the evaluations.
Okay.
Aaron, I thought, real quick, I thought that it was just because ours, we have like the youth mental health report coming up soon. And we're tracking things. I thought that the overall performance measures weren't due till the very end. That's kind of what we were planning on. So, but our members are serving through May. So,
Yeah. So, okay, so the youth mental health core performance measures, that's going to be next on the docket. So we'll
sorry.
talk about that. Those are separate, right? Because it's two separate grants. So two separate performance measures and reporting requirements. For Katie, because her service ends in May, you'll submit the progress report on April 15th. And then after she exit, you'll just update that with any, if there's any additional metrics to report, you'll update that at the end of service.
All right, yeah, and I had it in for April. That seemed like as like an end date, but I guess that makes sense if that's like technically the halfway point
Yeah,
for the
it's a hard
overall,
thing.
but it's okay. I just needed
Yeah.
to clarify because I was like, we weren't planning to do anything till April, but technically halfway through her service is very soon in some ways.
Yes.
So I was just double checking that we have the correct dates, and it sounds like we do. Thank you.
You do, yeah. So the progress report is required for all of the programs at the same time. So all of our programs are having to submit that. So it's the midterm for our program year as a whole for the AmeriCorps program year, because that's from September to September. It's not necessarily going to align with the midterm for your member service term
Okay.
because all of the members have different service terms and start at different times.
Okay, so then and this is for us and anybody else who's have members leaving before like the end of August or whatever that full term is, that so in the final report, we'll just update from the last month of activities in the performance reports with like the final evaluation.
Correct.
Okay, thank you.
Okay, so it is 2:34. Anyone else have questions before I get into the youth mental health core stuff? Okay, so if you do not have a youth mental health core member or you're not planning to host a youth mental health core member, you can log off. Or if you would maybe like to have an additional member down the road and want them to be a youth mental health core member, then please stay on, or if you just want to learn more. But for the last 30 minutes here, we're going to go over the youth mental health core training and reporting requirements. So again, the Youth Mental Health Corps is a separate private grant provided through the Schultz Foundation. These are actually the folks that own Pinterest, and they really wanted to leverage national service programs across the country to address the mental health crisis while also, providing workforce development pathways for individuals who are interested in careers in the mental health field. So the program initially started in 2024 in 4 states and has now expanded to 11 states. So Iowa is now included in those 11 states, and we're in year 1 of our 2-year pilot program. So we are not the only youth mental health core program. There are several programs within the state of Iowa. So any programs where it makes sense to engage a youth mental health core or to have youth mental health core activities is able to host youth mental health core members. So we have some programs here in Iowa and then in those 11 other states. So it is kind of a nationwide program that we're excited to be involved in to address the youth mental health crises in the United States through intentional service activities. So again, the program is really in its pilot stages, and so there are many AmeriCorps programs that are engaging their members in the youth mental health core capacity. And there are a lot of different ways. There's a lot of kind of flexibility, and it's been made intentionally broad to allow for, kind of creativity and innovation in the mental health space. So for your member, if they're a youth mental health core member, that might not be all that they're doing. It might just be one of their service projects, and that's okay. In order to be a youth mental health core member, the member has to be between the ages of 18 to 24. They need to the site needs to serve youth between the ages of 13 to 24 in some capacity. And so the member will be engaging with youth between those age ranges. And they need to have at least one of their service projects geared towards youth mental health. So that could include creating, updating, or translating outreach materials for community supports, hosting or participating in community outreach or wellness events, assisting with intake and referral activities under supervision, conducting youth-led needs assessments, asset mapping, provider and partner outreach, or community-engaged research related to mental health, hosting group or peer-led workshops for social and emotional support, or designing and delivering mental health and wellness prevention activities for specific groups. So if you have a youth mental health core member, at least one of their projects is probably falling within these member activities. As a youth mental health core member, there are some additional reporting requirements and training requirements. The youth mental health core members have to complete a survey from the Schultz Foundation at the start, end, and 6 months post-service. They have to complete some foundational training. So in addition to the training that all of our members complete, they also complete mental health first aid training and an additional youth mental health training. They complete career coaching with the career coach, and then again have those reporting requirements. The Youth Mental Health Corps also offers some optional opportunities. So there are monthly meetings with the Youth Mental Health Corps members nationwide that the members can participate in, and webinars as well. So I'll share that calendar of events at the end. Your members have been provided with these documents. So there are some additional professional development opportunities available to them that they can take advantage of. I already talked about the survey. The members are aware of this survey requirement. These are the links to the 2 trainings. So the public health training for community health worker training is something all of our members do. And then the youth mental health core members have an additional training. It's the youth mental health for community health workers training. It's just an additional hour, and that these need to be done within the first month of the member service. So these are all about resource navigation. And so the goal is that, we want our members to learn about what are the different health issues that Iowans face when it comes to mental health, food insecurity, maternal health, and then what are the resources that are available. So that's what these trainings cover, is kind of equipping them with some of the knowledge and skills to provide resource navigation throughout their service. And then the mental health first aid training is offered through Iowa State University Extension. It's a certification program. It's 8 hours. And so this has been difficult to coordinate because all of our members have different service schedules. Some are in school, some have other jobs. So we are offering a mental health first aid virtual training on January 10th that all of the members have been invited to, and we expect them to participate. It is on a Saturday. So just make note of that that's something your members will be engaging in. And so their service schedule might be adjusted slightly for that week. But we had to schedule it on a Saturday to be able to accommodate all of their different schedules. We'll likely offer another training on a Saturday down the road as we enroll new members, or if the member schedule allows, they can go to the Iowa State University Extension website and sign up for one of their upcoming mental health first aid trainings using the code below.
Hey, Aaron,
Yes.
backing up, do you know if Estella's done the survey? Do you have access to that?
I don't have access to it, but the program officers for the Schultz Foundation would have reached out to me if she had not. So
Okay.
I believe she's done it already.
Okay, great. Thanks.
Hey, Aaron,
Yes.
it's Cassie.
Hi.
Question about the mental health first aid training.
Mhm.
You might have already said this and I probably missed it. If they've already done this, are they still expected to be at that Saturday one?
No.
Okay, thank you.
But I would, can you have her send me her certificate so I can,
Yes,
because I have to track the number of completions for our members.
absolutely.
Okay, thank you.
Mm-hmm.
Okay, members also have access to career coaching. They'll have a career coach reach out to them to get those sessions started. All of our members are required to attend career coaching sessions with at least 3 times throughout their service, but the youth mental health core members actually have access to unlimited coaching, so they can meet with their coach more than that if they would like to. Okay, so now getting into the reporting requirements, because we have our first report coming up soon. So we need to track the number of youth mental health core members we enroll, the number of members that complete the certification pathway. So the pathway is both the community health worker trainings and the mental health first aid training, the number of youth served within the caseload, and the number of community members served outside of the caseload. We'll get into these definitions shortly, but and we also need some narrative to describe their activities. So those bottom 3, the number of individuals served and the narrative, that is what will be reported in the upcoming report, and that's what your members should be keeping track of throughout their service. So tracking youth served within the caseload. This is the number of individuals between the ages of 13 to 24. And then within the caseload just means all of the individuals engaging in the members' structured outreach activities as outlined in their member position description. So your member has their youth mental health core project or projects outlined in their member position description, and it will say, you know, maybe they're planning a community event, or they're doing resource navigation one-on-one with individuals, or they're having group sessions. It will be listed. Those structured outreach activities should be listed in their position description, and that is when they should be tracking individuals within their caseload. So you'll want to review the member position description to make sure they're aware of their structured outreach activities. The individual can only be counted once per service term, so make sure you're providing a name or unique identifier so that there are no duplicates. And this number is really where we want to have the most true and accurate numbers. So we want the members to be pretty intentional about who's being included within the caseload. So again, it should be those individuals between the ages of 13 to 24 that are engaging in these structured outreach activities. The foundation also wants to get a general idea of the number of community members that are impacted by the program in general. So this value is kind of more of a rough estimate. It's a little bit harder to track, but they just kind of want to have an idea of who's being touched by the program. So this would be the number of individuals of all ages outside of the caseload, which means individuals engaging in youth mental health activities in informal outreach ways. So spontaneous or casual interactions, drop-ins or informal sessions, tabling, and general resource sharing. So if the member's tabling at a community event and someone comes up and talks to them about the youth mental health core, about mental health, ideally we would want them to try and count that towards this count. Again, it's going to be a little bit harder. Or if they give a presentation and someone comes up, follows up after, or someone drops in, that would be considered outside of the caseload because it's not one of those structured outreach activities that was in their position description. So,
Hey,
yes.
is it okay if this number's quite low or non-exist, or like, what's the expectation for this? Like, we'll have the targeted youth activities, but I think there will be less so, or it would be kind of the same mental health screenings, but just for adults that would be reported. But I think there would be less spontaneous mental health focused interactions, if that makes sense.
Yep, and I kind of expect that this number would be less than the structure. I mean, this is really like, to me, my interpretation is that this is really like the important number. We want to know the number of youth served
Okay.
through the program, right?
That's what I thought,
Um,
but I just want to check
This
things.
is kind of just like a secondary measure. And so I've told the members, just really do your best with this. This is going to be a little bit harder to track, tracking like spontaneous interactions is kind of, that doesn't feel like a very natural thing to do. So I really just instructed the members, be really intentional about what's within the caseload and tracking that. And then when it comes to tracking the community members outside the caseload, do your best. So I don't really have expectations on how many or how many individuals that's going to be. We haven't been given a target. I think because it's the pilot program, we just want to, be tracking that and see where those numbers fall. But I haven't been given an exact number to shoot for.
Can you go back one?
Yeah.
Oh, can you go back one slide too? I
Mhm.
think it had some like, yeah, what it means with people doing activities.
Yes, and when I
Okay.
go into the spreadsheet, I feel like it will make a lot more sense.
Okay,
The
yeah, I
reporting.
was just, okay, perfect. Never mind. Keep going forward then. Sorry.
So I created a reporting tool because a reporting tool was not provided to us. So I created one that will hopefully, help your members track the individuals served as smoothly as possible. So they have this document. The first sheet is just the cover page, where they'll need to provide their name, position, host site, and then a brief summary of their activities. I've provided some key definitions here. So youth are individuals between the ages of 13 to 4 years old. Individuals served are considered individuals the members interacted with regardless of age through structured or unstructured outreach activities pertaining to youth mental health and well-being. So again, not all of your members' activities are youth mental health core activities. For the purposes of this report, we only want them including the youth mental health activities. Structured outreach are activities that are planned and organized, such as workshops, group sessions, presentations, or community events. Unstructured outreach are spontaneous or casual interactions like drop-ins, informal check-ins, or general resource sharing. The due dates are below. So the first report is due December 15th. If your member has not engaged with individuals in this capacity yet, that's okay. But the report has to be submitted on a quarterly basis. So this will be cumulative, and we, expect that these numbers will grow over time. So here's the spreadsheet with the specific instructions. So after, each youth mental health core activity, we want the member to be going into the spreadsheet, and documenting the individual's first name, last name, the date that the activity took place, and then they'll answer the question, is the individual between the ages of 13 to 24? So this is just a yes, no. Ideally, it'd be great if in the structured outreach, we want them to be collecting age so that they can answer this question. Or I guess using their best judgment, but best practice would be to be collecting first and last name and age for each individual, especially in those structured activities. Unstructured is going to be harder to do, so they can just use their best judgment. Then they'll select the type of youth mental health core interaction. So this is kind of the most important part. This is how we're going to pull the numbers to get the individuals within the caseload versus outside of the caseload. So they will select, yes.
I know you said the first quarter is due on December 15th, but if the member hasn't done anything yet or is still doing trainings, would you want us to just shoot you an email, or how would you want us to approach on that?
In the narrative section, just state that, the member has not started youth mental health core activities. So we just have that documented. So when you're selecting the interaction, you can choose between any of these options in the drop-down menu. So structured one-on-one, structured group session or meeting, structured community event, workshop or presentation. And then unstructured would be a drop-in informal conversation or general resource sharing or tabling. So as long as they're filling this out, I will be able to pull the number of individuals served within the caseload. That would be all individuals who answered yes to this question and engaged in a structured activity. And then the number of community members outside of the caseload will be people of any age engaging in unstructured activities. So that's how we'll report those numbers. So any questions about that? Okay, I think once that you start filling out the spreadsheet, it makes it easier.
Here's a question. If we have an activity planned to do outreach on something, and okay, so a metric for the other one could be number of events hosted, not for the youth mental health core, correct?
Right.
If you're, is that unstructured then if you're not targeting youth, but you're specifically like, is that structured or unstructured? I don't.
If it's not
I mean, and it
a
appears
youth,
to me that if they're at an event, they should be tracking the number of people they talk to regardless.
no.
I don't know. Okay.
So if it's not a youth mental health core activity, then you don't need to count it.
Okay. And so we don't
Does
need
that
to
make
track
sense?
we don't need to track the number of attendees at other events unless those events have youth at them.
Unless so for example, say Katie is tabling an event for Global Greens and she has some information at the table about youth mental health and about the wellness garden.
Yeah.
If someone comes up to the table and wants to have a further conversation about that, or asks about that, then that would be counted. But you're only going to want to include activities that are youth mental health focused.
Got it.
Yeah.
Okay. Okay. Although, never mind. I was gonna say like gardening, anytime you're in a garden, that's mental health, but
Yeah,
no.
I agree with that.
So, I guess I have a question about like a volunteer event, for instance, that is coordinated, and then we have a mix of youth and adults. Like we have a mix of people between 13 and 24, and because sometimes people come with kids too. So we can add a component where we're talking about mental health with them. But we don't need to track the adult numbers of attendees at something like that necessarily. That's just, we'd be tracking the event on number of events hosted for the other capacity building activities, correct?
Right.
But then we would only be counting the youth in this spreadsheet that we did the, like if we're doing youth mental health related activities
Like
in
if you're
that
having
same
activities where
volunteer
you're
event.
where you're teaching about,
Yeah.
you know, I know Katie's been doing like grounding experiences and like having
Yeah.
lessons on like the connection between mental health and gardening. So that
Yeah.
would, you would include that, and you would include all the individuals at that, adults as well.
Okay. 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 We'd include all the adults in this too then? Is that what you said?
If
If it's
it's a community event where the focus is there, it's at the wellness garden, right?
yeah. Uh-huh.
Like that's written into her position description as one of her youth mental health core activities, is like
Correct.
developing programming in the wellness garden
Yeah.
to promote mental health. So you would want to, yes, you would want to count all the community members there. And then she'll just know whether they fall
Okay.
inside or outside of the age group.
Okay. I got you. That
Okay.
that makes sense. And then on the other sheet that we've created for events, we just count that as one event.
Correct.
Okay.
Yes.
Thank you. Sorry for taking up the time for everybody, but maybe that helps you guys and how you're doing your stuff too. I don't know.
That's okay. And we are almost done, so no worries. Thanks for the question, Zach. It is helpful. Okay, so last quick little section for the report. Every member needs to provide one example or story per quarter. So obviously, if your member's not enrolled yet, then the report's not required. But if they are enrolled, this is your opportunity in kind of the narrative section to just say like, the member has not engaged with youth yet or has not started their youth mental health core activities, or, you know, perhaps you don't have any individuals to report, but your member is still working on projects, like maybe they're developing resources or outreach materials that are ultimately going to be shared, but they haven't gotten to that point yet, then you can provide some narrative here to just explain that like they're in the resource development stage of their youth mental health core activities, have not engaged with individuals yet. That would be okay as well. Any questions about that? And very happy to have a follow-up meeting with anybody who wants to kind of do a deep dive into either of these reporting tools. I've tried to create a tool for the youth mental health core reporting to make it as streamlined as possible, but some of the terms are a little bit ambiguous. And it is, I understand it's a little tricky when you have, you know, maybe only one of their projects is focused on youth mental health and the others maybe have a food security focus or are more workforce development. We really, for the purposes of this reporting tool, only want to count individuals that are engaging in the youth mental health activities. Any other questions? Okay. I'm going to go ahead and stop sharing then and stop the recording. Thank you to everyone for attending today. I appreciate your time. I will stay on if anybody